Panorama Privacy Awareness Training. There are two separate privacy and security training modules and agreements that must be acknowledged in order to gain access to Panorama. The first agreement is for all interior health employees. It will include all of the specific interior health privacy policies that are in place for all work completed within interior health. This is a yearly agreement that you will be prompted to complete through iSight. The second agreement is for Panorama. Training for this agreement is what you are doing right now. It also includes reading the official agreement and acknowledging that you will comply. This agreement is also renewed yearly, and you will be prompted to complete it by an email sent to you. Follow the links provided in the email. Once you have accepted both agreements, you are ready for Panorama training and access. Everyone who is working with the Panorama application has a role to play in protecting clients' information and keeping it private. Panorama is a federal application that is governed by provincial teams. The BC Yukon team has a responsibility to house and maintain security for all information placed into the application. In order for Interior Health to maintain access to Panorama, our team must complete and comply with specific responsibilities such as user access control and data quality. Our users of Panorama must also follow the rules and regulations set forth by their health authority and by the provincial Panorama team in order to maintain individual access to Panorama. All users of Panorama play a vital role in protecting our clients' information and complying with the provincial privacy of information legislation. Panorama is a very large application and is used by many populations of public health staff. All users of Panorama do not have the same access. Different roles have been created to mimic the different access needs of the Panorama users. The role that you will be given is based on the type of information that you will need to access in order to give the most informed clinical care. Sometimes your role may allow you to access areas of information that you may not need. Just because you can access the information does not mean you should. Only access the areas that you need and are trained to use. It is important to keep client information accurate, safe, and protected. A user must only create, view, update, and access information if required to do so to fulfill their specific roles and responsibilities. Never look up information unless it is needed for client care, and never look up your own information. Your access to Panorama should not be shared with anyone else for any reason. It is for your use only. Do not share client information unless sharing with other clinicians. Follow the guidelines set within the Freedom of Information and Protection of Privacy Act. Only document your care and do not document on behalf of another coworker. When a user creates or updates data, you must ensure that the information added is in the right spot, it's accurate, and it's complete to the best of your knowledge and ability. Data quality is extremely important. Data and documentation standards have been established in order to maintain parameters of where and how information is stored within the client record. Common understanding of where and how information is entered is important to maximize client care and avoid clinical risks and errors. Please follow all Panorama guidelines and standards that have been created for Panorama documentation. User access and documentation will be audited on a regular basis. These audits are completed both provincially and by our IH Panorama team. Audits can identify both improper access as well as data quality. Improper access audits include most frequently accessed clients by Panorama users, Panorama users who access the highest number of clients, users who look up their own information or family member information, and users who look up Panorama users such as coworkers. If irregular activity is identified, the Panorama Users Manager will be notified and an initial investigation will occur to determine if unauthorized access has occurred. For data quality, there are 3-level audit processes in place. Level 1 audits are performed by our I8 Panorama support team either by random, post-training, or by special request. Any errors will be sent to users to fix and their team leads or supervisors for follow-up. Level 2 audits are for any critical errors identified in a Level 1 audit. Errors will be sent to the user to fix and the team lead or to follow up, similar to Level 1 audits. A 1-month post-repeat audit of the same user will be completed. Level 3 audits will occur if critical errors continue to be identified in the repeat audit. Refresher training or retraining will be offered and another 1-month post-repeat audit will be completed. If critical errors continue, access will be revoked. There are 4 different types of unauthorized access to Panorama. These include accessing information on an individual that is not in your care, sharing your access with others or using another user's access, not protecting your access or protecting the client's information, and accessing Panorama when not working as a public health I8 employee. Unauthorized access can be caused to revoke a user's access to Panorama and could lead to disciplinary action. All user activity is logged and subject for review. All users of Panorama should be careful not to connect to Panorama using unsecured networks. When working outside of the office, make sure to use an I8 Air card for network access when using Panorama. The provision of reasonable security is a requirement under the Freedom of Information and Protection of Privacy Act. Connecting to Panorama via an unsecured network has the potential to open vulnerabilities in the network even if you're using a VPN. Users should avoid connecting to their VPN and Panorama using public and unsecured networks such as those found in airports, coffee shops, and open networks provided by internet service providers such as Shaw Open. Reporting potential privacy breaches is very important. Reporting is important if you have reason to believe that a breach may happen, is happening, or has already happened. A privacy or security breach is any access, collection, use, modification, storage, disposal, or disclosure of Panorama data that is not authorized. A breach can be accidental or deliberate. If a user has reason to believe that there has been a privacy breach, they must notify the Privacy Department for IH. Voluntary reporting by employees, users, and patients and clients of suspected privacy breaches is strongly encouraged. IH will not dismiss, suspend, demote, discipline, harass, or otherwise disadvantage any person reporting of a breach or potential breach. The confidentiality and acceptable use acknowledgement needs to be accepted on an annual basis. This is completed through an electronic acknowledgement for IH. An email will be sent to you every year prompting you to read and accept the acknowledgement. If you ignore this email and do not accept, your access to Panorama will be revoked. There are standards in place for creating a client record for a client who does not wish to disclose enough client identifiers to create a determinate client record. These standards must be followed in the rare instance when creating an indeterminate client record is warranted. You are responsible for understanding the policy and data standard and applying those sections that are pertinent to the services you provide. Keeping client information safe stems past the use within Panorama. Information collected and stored within Panorama should be protected in our communications as well. Please follow Interior Health privacy and communication policies for all forms of communication. These forms include in-person, telephone, fax, social media, email, text, and written. Users of Panorama or end users have a role to play to safeguard personal information in Panorama. Get informed and understand privacy and security standards. Make sure your physical space is secure. Make sure your computer is always secure, and handle client information appropriately. Managers and the privacy officer also have a role to play. They provide the training and respond to questions. They provide policy and procedures to support privacy and security. They support proactive audits and assessments to evaluate the privacy culture. They address potential privacy weaknesses. They report events associated with the possible privacy breach, and they support investigation of privacy breaches and take action. Panorama provides access to client records anywhere in BC or Yukon for public health information. Privacy controls are built into Panorama, including, but not limited to, a role-based access model. User access to Panorama is audited and monitored at all times. When communicating with a client, ensure the mechanism used and the content included in the communications protects the client's right to privacy. The terms of the acceptable use acknowledgement apply while at work, off-duty, and extend beyond the completion of your current employment. Understand the privacy safeguards and tools available to you, and be proactive. Understand your privacy responsibilities and attend privacy training when delivered by IH. Privacy is everyone's right. Security is everyone's responsibility.